Hi everyone, my name is Emily Clancy, and I prefer the pronouns she, hers, her. So I am the East Michigan community organizer for Planned Parenthood Advocates of Michigan, which is our C4 side of the organization, and Planned Parenthood of Michigan, as you know, our health centers and our education staff, C3 side of the organization. So I'm here today to talk about culturally competent providers, and obviously there's more than one way to be a culturally competent provider, but specifically looking at how Planned Parenthood exemplifies that within the LGBTQ plus community. So just to give you a little background about my role, so as the East Michigan community organizer for Planned Parenthood Advocates of Michigan, I'm responsible for leading strategic organizing efforts around reproductive justice, conducting extensive community outreach. So you may have seen us at Wayne State, we come here a lot, or Pride, lots of summer outreach events. And I'm responsible for building a robust network of volunteers in Wayne County, Oakland County, Macomb, and Genesee County. So that's a lot of ground to cover. So I don't, my office is in the health center on Cass Avenue. I'm not always there, I'm kind of running around a lot, but I do interact with the health center staff often, and we actually have a volunteer program in which our patients sort of reach out to, I'm sorry, not our patients. We have a volunteer reach out to the patients and sort of try and communicate and bring those two the advocacy side and the health center side together. So just to give you some context for like where I am in the organization to kind of understand how we impact the LGBTQ community. So before we really get into some of the nuts and bolts, I think it's important to talk about who we are as an organization and where we started from. So, you know, from Margaret Sanger, our founder, to Cecile Richards, Planned Parenthood has been advocating for sexual and reproductive health for over 100 years now. So Planned Parenthood was founded on the revolutionary idea at the time that all women should have access to decide whether or not to have a child. And over the years, as birth control and abortion became more legally acceptable, that definition of our mission has really expanded to encompass the idea that all people should have access to high quality health care that they need and deserve. So really kind of looking at it from just focusing on women's healthcare issues to now expanding 100 years later to encompass all sorts of minority groups and different communities, how we can provide healthcare to them. So currently there are more than 600 health centers across the US and 19 Planned Parenthood health centers in Michigan. So in this Metro Detroit area, we have Detroit, Warren, Livonia, and Ferndale. So we have 4 health centers. So as I mentioned, like sort of the mission of Planned Parenthood has expanded to this care no matter what model, right? So rather than just being a basic healthcare provider, we look at the whole entire patient. So not just the body, but we want to make sure that we are informing and educating the mind, body, and sort of spirit of the person we see and are respecting their identity and how they choose to identify themselves. So at Planned Parenthood, we really want anyone that comes through our door to feel like they are welcome here, no matter what, no matter your race, your immigration status, your class status, your education level. But specifically for the needs of LGBTQ individuals, we understand that you know, Planned Parenthood has really built this reputation of being a trusted provider in the community. I think since our founding days when we sort of fought for the access to birth control against all odds, right? So I think the reputation of Planned Parenthood has developed to be a very community-centered focus. And so when we talk about the needs of LGBTQ health individuals, we recognize that Planned Parenthood may be the only place that they come to receive health care. Maybe it's the only place they know where they feel comfortable and respected as they are. And so I think it's important, as all the previous presenters mentioned, when we talk about LGBTQ healthcare needs, we need to acknowledge that members of the LGBTQ community experience multiple obstacles to obtaining and benefiting from sexual and reproductive healthcare services. So in addition to like the high rates of stress and just trying to find a provider, right, you also have the systemic discrimination and harassment of LGBT people that not only impacts their mental health, but then prolongs their ability to find a competent provider for them, right? LGBTQ people face lower rates of health insurance coverage, even with the implementation of the ACA. We know that's still a concern. Higher rates of HIV/AIDS, and higher rates of discrimination from healthcare providers. Maybe it's not even intentional, sort of like some of the previous presenters said. Maybe it's just that the staff at the health center doesn't understand the use of pronouns and how using the wrong pronouns can really debilitate someone's experience and kind of send them into a really traumatic emotional experience. But even so, just thinking back to what I covered here, and then when you add on also being a person of color in the LGBTQ community, that is even like more rates to experience racism, sexism, and homophobia. So it really is just finding a healthcare provider. You can try and empathize and understand how difficult that experience may be. Like, it's already hard enough to do. I just got my health insurance for the first time in charge of it, and it's really difficult. So that's why it's so important to be loud and proud about the care you provide. So how do we do that at Planned Parenthood? Whoops, here, 1 second. So there's a couple different ways, actually quite a few different ways that we make sure to be as inclusive as possible when it comes to our LGBTQ community. So number one, as a staff member of Planned Parenthood, I can attest to the rigorous amount of webinar, internal sort of trainings that you go through when you're hired that talks about health disparities in different communities. What is gender identity? How is it different from sexual orientation? So especially as a medical provider at our health centers, you're really well versed and trained in all of these areas of knowledge, so that no matter who you are, you should sort of develop the curriculum and language that's appropriate for this community. Also, on our intake forms, this is something that Planned Parenthood recently changed. You can identify your preferred gender pronouns, your preferred name. Of course, we still ask, like, what is your biological sex for insurance purposes? But we try and make the form as inclusive as possible so that our health center staff can take note of that, and then when they're visiting you during your visit, they can be very self-aware of what kind of language they want to be using. So I think, you know, Planned Parenthood has really, how do I want to say this, emphasized that we are a place for women to find healthcare services, right? The woman aspect has been very heavy throughout the past years. But as throughout the years, we've made some progress. I think we're trying to not necessarily move away from the word woman, right? But just to understand that people who get abortions aren't always women. So we want to be sensitive to that and take great care to understand that. So that's why we kind of collect some of that information on our intake forms. And I think just it sets a tone right when you enter our doors that, hey, we're here for you and we want to respect you as you are with dignity and respect. Okay, so other ways that we proudly serve the LGBTQ community. It's not in Michigan, but Planned Parenthoods across this, our country in 17 states offer hormone replacement therapy. I would be really excited for this to come to Michigan. I'm hoping like that this is sort of like the next wave for Planned Parenthood to be really the leading provider in LGBTQ healthcare, and kind of like transforming the way we think about healthcare in this nation to really focus on the needs of, obviously, like I mentioned before, not just this minority community, but all the other communities that experience health disparities. At Planned Parenthood, we provide HIV testing and really link patients to treatment options, which is an essential step in reducing the transmission rate and really impacting people's lives. Also at Planned Parenthood, as part of our education arm, we have a peer education program. So we do, basically, we have a community outreach educator that goes into the schools in the Detroit area and teaches kids about sexual orientation, gender identity, and then they come back and meet at the health center like once a week and sort of develop these lesson plans and curriculum so that they can go back out into their community and advocate for sex education, gender identity, issues of sexual oppression that they want their community to take a lead on. So that's a really cool program that we have that supports our youth. And so it's more than just we recognize providing care to whatever healthcare service they need, but actually kind of stepping up and saying, we're visible for you in this way. We want to show up for you at school, at outreach events in your community, and we want to be an advocate for these other issues that you're facing beyond healthcare. So just piggybacking off of that, some other ways that Planned Parenthood is really inclusive in serving the LGBTQ community is like having staff like me that's able to actually work within these pockets of communities, like attend Pride, show up with our Planned Parenthood Pink at at Transgender Day of Remembrance, when there was Trump banned transgender people in the military. We wanted to, fight back on that and really advocate for these other issues, saying if you come for one, you face us all. So I think having the advocacy arm has really helped Planned Parenthood in ways that other providers may not be able to do, to really show that we are here for you and like your battles are our battles. So I think that has really helped just to complete the whole picture that Planned Parenthood is a competent provider, and we are not only just doing that within our health centers, but I'm trying to teach, for instance, the volunteers I work with, the correct language to use and why it's so important. So it really touches all facets of our community beyond our health center walls. So that is really all I have, just to give you a brief overview of how Planned Parenthood really attests to being a competent provider for the LGBTQ community. Does anyone have any questions or comments? Yeah.
I have a question about funding.
Sure.
Is the current administration had a negative or positive impact on funding for Planned Parenthood?
I would say right now things are okay. Last summer we had a battle in front of us when the Trump administration was trying to dismantle the ACA and then defund Planned Parenthood. But what they meant by that was basically just not allowing our patients who access Medicaid to come to our health centers for healthcare. So that was the main battle there. That didn't happen. Patients that use Medicaid are still able to come to our health centers, even if you don't have Medicaid or no health insurance, right? That's another way that I didn't even mention, that Planned Parenthood is a competent provider, that it's like a sliding scale fee. So right now, we're pretty safe. I mean, there's always things to watch, like Title X, the nation's family planning program. They want to cut funding, like line items to Planned Parenthood through that, and the teen pregnancy prevention program could hit our education programs, but in terms of the care that we provide at our health centers right now, things are looking good in the state of Michigan, and we will see what happens in 2018, obviously, with the governor's race, because that is definitely dependent on where we go from here.
Is it mostly funding from the feds or from the state or a combination?
Most of the government funding we receive is mostly all from Medicaid reimbursement at the federal level. So we don't really, other than grant money, like for a few specific education-focused grants, I think, we really don't receive any money at the state level. Yes?
I have one question, but then it's turning two. So you talked about how 17 states provide hormone therapy as well.
Sure.
Planned Parenthood clinics. What are the steps that need to be taken in this state to have that be implemented here? Is question one. And question two, because you mentioned the 2018 race, do you see any candidates in the 2018 race who are who have been vocal about supporting Planned Parenthood?
Yeah. So I'm going to be honest with the first question. I am not sure how these other states have been able to do the work with hormone treatment. therapy. I'm not sure, to be honest, the steps to get there as from the
Is it something
perspective.
with the state too, like you have to get the state approval for?
I'm sure it is kind of like an entangled, complicated mess. I can kind of look into that and follow up with you on that information, but it is something I've been wondering too, like how do we get to that point even? And I'm honestly not sure where that would come from. But I do think it is something that I would like to look further into and kind of find the answers there. With your second question, yeah, there has been a lot of candidates stepping forth that have been really supportive of not only Planned Parenthood, but just the LGBTQ community. This is not an official endorsement or anything. So second note that Planned Parenthood does make official endorsements based on our questionnaires. Those will happen in May. But someone that's been a big ally for the LGBTQ community, Dana Nessel, who's running for Attorney General, which we know is so much better than the current Attorney General that we have right now, just miles ahead. So yeah, I mean, I think it's also important to look at like how are candidates actually talking about the LGBT community issues? Like, are they actually informed on the issues that they face? Or are they just trying to, placate to that community and really look into like how have they voted in the past? And like be looking into those questions when you're thinking about who to vote for and that sort of thing. But yeah, I think overwhelmingly Democrats know that they should be on. They should support LGBTQ rights and Planned Parenthood if they want to have a shot at winning.
News just broke this morning about the Senate, considering the time in the Senate about states being able to withhold federal funds from Planned Parenthood. When you mentioned that it's not about state funding and federal funding, so with that, are there other places to get the funding? If that does, it's now going to go to Trump, which doesn't look great.
Right. Okay. So one, we are really not funded by the state of Michigan at all. It all comes from federal reimbursements for Medicaid. Other places to look for that kind of funding is really our private donors. That's why we see so much money coming in, a lot of like big names kind of donating to Planned Parenthood because really like that, most of that will all go to patient care. When people come through our door and they're not able to pay fully for their services, we're not even fully reimbursed through our Medicaid reimbursement. So that's why, no matter sort of how many donations come in, like it won't be enough. Obviously it's helpful, but we need all that we can to keep providing the services that we do in this really crippled healthcare climate. Does that answer your question?
Yeah, it is just scary that they can withhold the federal funding.
Yeah, it is. And I honestly, I have not been online all day. I've been kind of running around. So I'll have to look into that. Definitely, if for all sort of updates like that, if you follow Planned Parenthood Advocates of Michigan on our Facebook or Twitter, you'll get like all great big breaking news updates through there. And you can just kind of see where the state of Michigan is at with what's going on at the federal level because it's a complicated web, as we all know. Any other questions? Yeah.
I just found it interesting that I've lived in Bologna my entire life and didn't even know there was a Planned Parenthood in my backyard.
Oh wow, yeah. The Bologna Health Center is very small. It's on Ann Arbor Trail, but they're actually moving locations very soon here. So I think they're moving to a bigger clinic. But yeah, a lot of people forget about that. I even forget it's there too sometimes. Like it really is like the smallest health center we have. But yeah, we do have a health center there, and you can find the new location. It'll be announced online.
Thank you.
Also, one more point I want to add before closing out. I think that, in being like a leading voice for LGBTQ care, Planned Parenthood isn't perfect, just like we haven't been perfect in the past. And when I make mistakes or our health care providers make errors, we really do appreciate the patient feedback. I understand it can be emotionally laborious to sort of go through that, but just to give you an example, we did a pad and tampon drive that I organized at all of the health centers in the Metro Detroit area throughout the holidays, and one of the signs I made said feminine hygiene items, and I didn't even really think about that. Like, oh, why don't we just say like menstrual hygiene or hygiene, pad and even hygiene is kind of like a weird word for pad and tampons. So someone pointed that out to me. I was like, oh yeah, I didn't even think about that. So, you know, we have a long ways to go in sort of breaking down these gender binaries, but I'm really proud to be working for an organization leading the way for change in a lot of ways. So any other final questions? Or yes?
Just one other thing. There's a Michigan State Representative, Pamela Hornberger.
Yes, yes.
Could you talk a bit about her as well, because she's proposing a bill to score abortions as infanticide as well in the state of Michigan. She represents Baltimore.
Now, I'm sorry, is this for the bill that would criminalize a fetus or like add another layer in?
I'm just looking at her thing. It says criminal procedure sentencing guidelines scoring of offense variable 9 clarify that an embryo or fetus must be scored as a victim.
Yeah, so this is I think it passed through, it was introduced in the Senate, if I'm correct, or maybe it was the House. I think it was originally House Bill 4500, and the language is very kind of confusing, but it basically talks about that if there was an instance, a crime, where, let's say, a woman didn't know, or a person didn't know that they were pregnant, and if in that instance the fetus or embryo is harmed, that sort of like layers on another sentencing period. So it's sort of disguised in a way that would, you know, be beneficial to a person in that situation, right? But really what it's trying to do is give personhood status to a fetus or unborn person. So that is something, yeah, I know that there wasn't much movement on that after it was first introduced, but now I think it's moving again. Yeah, it's in committees right now. So House Bill 4500, I believe is what it is. So there is info, I think, on our website about that specific bill, and definitely keep updated on our action alerts or call, her name is Hornberger. I should know that I'm from New Baltimore. Give her a call. I might pay her a visit and talk, like, hey, anyone want to go out to New Baltimore and knock on her office? But really, that's sort of the things that I do as the advocacy arm of Planned Parenthood, really mobilizing people like you guys just to come in and share your stories and why this is wrong and vote against this and really hold our legislators accountable. Yes?
Simple question. If you happen to be a legal adult and you're like 19 and you're still on your parents' insurance, you
Yes.
have to access Planned Parenthood services?
Yes, absolutely. We are sensitive to or minors, or you're saying like age 19 even. If you're still on your parents' health insurance, and let's say you come to Planned Parenthood and you don't want your family to know, you wouldn't be able to use that, your parents' insurance, right? But you would still be able to come to our health centers for care and just pay what you can based on like a sliding scale fee. But especially for youth of like that age, we have specific like Title X grants that would cover some of those services if they needed. And that's another point too I should make, like if, you know, when doctor's office make follow-up calls home, with Planned Parenthood, we always want to, like, it's on our intake forms, like, are you feel comfortable us calling your home office or you at your home? Should we say we're Planned Parenthood, or who do you want us to be identified as? So we're just taking all this identifiable steps to make sure that that patient is safe, even after they leave our health center. Awesome. Well, thank you guys so much. I have information on the back table too if you have any questions. So awesome.